Hello, John. My name is Tony, and I'd like to explain and discuss the results of the battery of Beck assessments you recently completed. To review, you reported experiencing a very serious array of issues in pretty much every area of your life. The assessments you completed are designed to assist us in determining your level of risk in the target areas of depression, hopelessness, anxiety, and suicidal ideation. It is important that you are aware that the results obtained from this testing are not meant to be used as a determining factor in labeling or formally diagnosing your mental health. I mention this because it is not uncommon for a client to assume that the results of these assessments become part of their permanent mental health profile. In reality, the assessments are meant to assist us in developing an appropriate treatment plan based on your identified concerns and level of risk. I may ask you to retake some or all of these assessments as we progress through the treatment, just as a means of identifying areas of progress and areas that could use more attention. Your results are compared to mass groupings of other scores that are meant to be representative of the general population at large. We do this because population comparison allows for a much more accurate determination of risk level and minimizes error. When a test taker's levels are determined and compared, they are generally considered accurate and reliable. So anyway, let's look at your results. Your score on the Beck Depression Inventory indicates that you are suffering from severe levels of depression. An area of particular concern is the statement you have made regarding suicide, specifically that you reported you would kill yourself if given the chance. This is obviously an alarming statement and one that we're going to need to look into further. Your score on the Beck Hopelessness Scale indicates you're in the moderate range, which again may indicate an area of concern because scores in the moderate to severe range are indicative of an increased risk of suicide. Due to your severe level of risk determined by the Beck Depression Inventory, I believe there's a picture emerging that we need to really pay close attention to. Your score on the Beck Anxiety Inventory again finds that you're in the moderate risk category. An area of particular concern for me is your statement indicating that you harbor a fear of losing control. John, the results of these assessments, contrary to what it may seem, are not meant to enhance your feelings of depression. Instead, please try to view and receive them as a foundation for your treatment plan and eventual success. Finally, let's review results from the Beck Suicide Scale. Your score on the scale contradicts the results of your preceding assessments. I view this contradiction as a positive upon which we can build. Severe depression can certainly press on your vulnerabilities, your nerves, your willpower, and this can lead to severe lows that may or may not last, and often they don't. And honestly, this is more common than you may realize. So, as we move forward, I'd like to obtain certain bits of information that I think will assist us in creating a game plan. First, do you currently have a suicide plan? You know, have you created a plan? Is one in place? Have you thought about something, a way in which you would carry a suicide out? Second, do you have reasonable access to the things that you may require to carry out your suicide plan? Third, when you feel suicidal, do you have thoughts of hurting anyone other than yourself? And if you do, who? Fourth, do you have access to any reliable support systems that can assist us in monitoring your condition and progress? It is important that you realize that we do have more immediate options available to us, if you feel that would be necessary, or if we come to the mutual decision that your symptoms and your feelings are such that they would be necessary. And those options would be inpatient treatments, or we could even do a referral to a prescribing psychiatrist who can then recommend and prescribe antidepressant medication that honestly may go a long way toward relieving your most severe symptoms. I would like to go through your assessment results together and come to an agreement on how we should proceed. John, it is critical that you understand that we are in this together and your immediate safety is our primary concern.